want to say, Sahana, thank you, and Gateway Association, thank you so much for having me. It is a pleasure to be here with you guys and spend a couple hours this evening with you guys talking about something that's important as this. So again, my name is Janan Nasruddin. I am the Director of Catalyst Training Services. We are an organization located here in the city that specializes in mental health training and advocacy. Even though we're stationed here in the city, I do travel across the country, training, educating, advocating, all in the areas of mental health. By trade, I'm a certified child and youth care counselor. I specialize in working with high risk and vulnerable youth, particularly in the area of drug addiction, gang affiliation, and sexual exploitation. Those are the three areas that I specialize in. And I was doing that for about 20 years before I transitioned into mental health specifically. But when you look at a lot of the work that entails working with vulnerable youth, mental health seems to be the common tie that binds. So a lot of the work that I was doing in the capacity of youth care transitioned seamlessly into mental health. So I come to you today with a variety and a plethora of experience, knowledge, access to resources that my intention today is to share with all of you and just kind of serve it up to you on a silver platter. So I hope you guys enjoy today's session.
Thanks, Janan. The first question I have for you is, quite often people use these two words interchangeably, health and illness. So mental health, mental illness. Can you share a little bit about how you think about it and how does this impact people?
Oh, fantastic question. When we think about mental health, there really can sometimes be a negative element to that word. Hey, there's really a negative connotation to that word. But we cannot talk about what mental illness is until we first talk about what mental health is. So what I'd like to do is I'd like to step back a little bit and define what is mental health, because mental health and mental illness are two separate things. So when we talk about mental health has to do with your emotions. It includes your emotions, the way we feel. It includes the psychological, the way we think, and it includes our social well-being, our connectivity, how we relate to self, how we relate to others, how we're able to foster healthy relationships, and our ability to live a full, meaningful life. Now, when we look at mental health, your mental health determines how we handle adversity, how we maintain relationships, the choices that we make in our lives. All of this pertains to our mental health. When we talk about mental health, there's two really important key factors that you always need to remember when we're talking about mental health. Number one, everybody has mental health. That is one of the stigmas that I want to debunk right out of the gate. I can't tell you how many times I do intakes with people and I say, tell me about your health. And they say, oh, I'm great. I go to the gym. I do what I need to do. Everything is great. And I say, fantastic. Tell me about your mental health. And I have a vastly different response. Are you implying I'm crazy? Or what do you mean? Why are you asking me about my mental health? Like it's this dirty word. But I really want to stress, we all have mental health. Just like we all have physical health, right? We all have mental health. And even though with, let's say, our physical health, let's say that I break my leg, for example, and I'm wearing a cast and maybe I'm using crutches to walk. Even though my physical health is compromised, you still have physical health. It's the same thing with mental health. Even if you're experiencing bouts of depression, bouts of anxiety, and your mental health might not be optimal, you still have mental health. One of the things we always need to remember is that just like we have physical health, we too have mental health, okay? And sometimes we have really good mental health, and sometimes it's not so good. Which leads me to my next key factor that I'd like you to always remember. So in addition to the fact that we all have mental health, it's also important to remember that our mental health is not static. Now, what do I mean by that? What I mean is your mental health ebbs and it flows, it changes and it fluctuates. Sometimes we have really, really good mental health, and then we experience a traumatic event. Is that going to affect our mental health? Absolutely, it will, right? And so it's always important to remember that just because we experience bouts of poor mental health, that doesn't mean that we stay there. Even though a person is diagnosed, let's say, with a mental disorder, they can still go on to have an amazing, productive, fruitful quality of life in spite of their illness. So it doesn't necessarily mean that if you experience it, you're going to stay there. It ebbs and flows. Think of your physical health, right? Just like sometimes you have good physical health and sometimes you have not so good physical health. It's not the same your whole life. It's the same thing with mental health. But everybody has mental health. No one is void of it. We all have it. It's just a question of, do you have good mental health or do you have not so good, maybe poor mental health, right? It's on that spectrum. What does that look like? So, Sahana, back to your question. When we look at what is mental illness is mental health that's been compromised. Okay, so it is when our emotional, our psychological, and our social well-being are compromised. There is an impairment in these areas. So the way that we think, our mood, our behaviors are compromised. They're affected. They're not functioning as efficiently as they would if we had really, really good mental health. So examples of what this could look like is eating or sleeping too much or too little, pulling away from people or activities that we once loved, having unexpected aches and pains, hearing voices or believing things that aren't true, thoughts of harming self or feelings of harming self or others, or an inability to take care of yourself, follow through with your responsibilities, and meet the daily expectations of your life. That's what we mean when we talk about mental illness. It's that impact on a person's ability to function. Does that make sense?
Yeah.
Everybody, does that make sense? Oh, I love all the pretty thumbs I'm seeing. Excellent. So a thing too to also factor in is that when we're talking about mental health, there are many factors that contribute to experiencing poor mental health, right? So we can look at things like biological factors, your genetics, your brain chemistry, that can play a role in it. Having a history of mental health problems, that could be a contributing factor. As well, life experiences can also play a contributing factor in a person's mental health. So for example, if you've experienced severe neglect or abuse as a child, if you've experienced a traumatic event, that can contribute to poor mental health. But again, I really want to stress that your mental health ebbs and flows, it changes and it fluctuates. It's not a static condition. Does that make sense?
Mm-hmm.
All right.
So
Go ahead.
I think you draw a really good distinction between the two.
Mm-hmm.
And I'm curious, when you talk about barriers, right, to understanding our own self or even wanting to reach out,
Yeah.
I know you talk a lot about stigma and how that plays a role in not making, resources accessible. Can you go into that a bit?
Absolutely. Absolutely. So let's talk about stigma. We've all heard this term stigma. Stigma really rears its head when we talk about mental health. Okay. And what do we mean when we talk about stigma? What does that mean exactly, especially in relation to mental health? When we talk about stigma, it is prejudice and discrimination married together. Now, let me dissect that a little bit. When we think about prejudice, it's those fixed and false beliefs, right? It's those belief systems that are not based in fact, right, that get passed off as fact that can in fact be quite dangerous. So an example of that can be people who are mentally ill are dangerous. Okay, well, there's actually no science behind that to justify that, right? But unfortunately, many people to this day still believe that, right? Or that mental illness is a weakness, right? Those are some prejudices that we adopt along the path of our lives that gets passed off as truth. Now, when we mirror those fixed and false beliefs with discrimination, it's the act of acting upon those beliefs. So, for example, if I think that this person who is struggling with depression is, quote, dangerous, I may not hire them for the job that I need, or I may not send my kids to that house for trick-or-treating, right? Because they're dangerous. So I may not give this person the promotion that is coming up, even though they have the education and the expertise to back it up, right? So again, it's prejudice and discrimination mirrored together. Now, one of the things to keep in mind when we're talking about stigma, stigma is devastating when we talk about mental health. It's in particular devastating to the person on the receiving end of it, because not only does it drastically affect a person's self-esteem, right? They develop a sense of loss. It robs them of social opportunities, things like promotions we talked about earlier, things like connecting, having friends, obtaining or maintaining relationships, obtaining or maintaining employment. All of these become compromised. And what it does essentially is that it shames us into silence, right? And one of the things that we know to be true is that secrets keep us sick. And when there isn't a platform to talk about what's going on in a safe way, minus the stigma, it further perpetuates illness, right? And so we have to get to a point where we make it okay to talk about not being okay without the fear of stigma playing a role in it. What absolutely devastates me is that 60% of Canadians who are struggling with their mental health will not get the help that they need in fear of stigma. Isn't that devastating? And the thing that's the most heartbreaking is that mental illness is treatable. All mental illness is 100% treatable. Now, I really want to clarify this because sometimes people hear treatable with curable, and those are two separate things. There are certain mental health disorders that are chronic, meaning that once they have that diagnosis, they'll always have that diagnosis, and they'll require treatment long-term. Things like bipolar disorder, things like schizophrenia or having a psychotic disorder. These are chronic disorders. But that doesn't mean that a person who has these disorders won't have a good quality of life. I know many people who are diagnosed with schizophrenia who have master's degrees and live, a fantastic life in spite of their illness. But when we talk about treatment and it being treatable with the right supports, with the right connectivity, with the right connection to those natural and professional supports, a person can go on to do amazing things in spite of their illness. But it starts with being a mental health ally, and it starts with breaking down the stigma. And there's a couple of ways that we can do that. I always love to talk about combating stigma using the 3 E's. And it's educate, empower, and emulate. So let's dissect that a little bit. Educate. Exactly what you guys are doing right now, coming to forums like this, coming to information sessions like this, where you're getting information, you're figuring out what mental health is versus what it's not, and you're getting factual information, right? That defeats stigma. Number 2, empowering. So not only are we empowering others, but we're also empowering ourselves. We're being that mental health ally, that safe space for a person to say, hey, I'm not doing good. Can I talk to you? Or on the flip of that, us recognizing stressors in others and saying, hey, here's what I notice. Are you okay? Right? We're creating a safe space for us to say, here's what I'm noticing. And by doing that, by being that mental health ally, not only do we create change in our own home, we create it in our families, we create it in our workplace, and we create it in our communities. So important. And the last thing, the third E, is to emulate. This is where what we expect of others, we also demonstrate in ourselves. So we kind of walk that talk, right? We're using appropriate language when we're talking about mental health. We're practicing what we preach. We're being that mental health ally, and we're really just creating a community of wellness. And I just think it's so important, but it starts with combating stigma, really being mindful of our language that we're using, and getting people the support that they need.
Awesome. Thank you, Janan. I think it's often, it's not lack of resources. Sometimes it's a stigma that gets in the way.
Mm-hmm.
Yes. Pam says yes to many of the comments you're talking about. Okay. So I guess I want to go a little bit into language. What role does language play in accessing support, or even recognizing that individuals need support? Can you talk a bit about that?
One of the biggest catalysts for stigma is the language that we use. Inappropriate stigmatizing language can absolutely perpetuate stigma and further silence us, right? And can be a huge barrier for people getting the help that they need. And full disclosure, full transparency, when I first got into mental health and first started training in mental health, I thought, being in the line of work that I am, that I had a pretty good grasp on what is appropriate language to use and what's not appropriate language to use. And I have to tell you, I had a few aha moments. And one of the things that I learned is to really be intentional in the language that I use. Really stop and ask yourself, what do I mean by what I say? And if I was on the receiving end of those comments, how would I feel about that? Like when I hear the term, oh, this is so crazy, right? And this is a term that we hear all the time, right? And it's applicable to various different things. But when we use that term crazy originates from psychosis, right? So when we use language like that, it's really defeating to a person who may in fact be struggling with psychosis, hearing things that aren't there to you and I, or seeing things that aren't there to you and I, and it can further shame us into silence. So one of the things that I really want to stress is when we're using language, always make sure that we are using person first language, not illness first language. And I want to give you an example of this and see for yourself the impact that this makes. When we reference a person who's struggling with psychosis, let's say, and we say, there goes that schizophrenic. When we lead with illness, when we describe a person by leading with their illness, everything that they are outside of their illness takes back seat to their illness. They are a schizophrenic, versus saying they are a person living with schizophrenia. That slight difference, that slight shift in our language, to you and I might sound like semantics, but to a person who's living with that illness, what it does essentially is it makes room for them to be so much more than their illness. And the heartbreaking thing is that we tend to do this a lot with mental health ailments, where we use language that leads with illness. We don't do that so much with physical health ailments, right? Like you would never say to somebody, there goes irritable bowel syndrome, right? We would never say that because it's rude, it's offensive, right? You would never say to somebody, there goes, cervical cancer. You would never say that. It is so incredibly offensive to say that, right? But we do it with mental health all the time. why the difference? Your mental health is your health, right? They are one and the same. And so why do we show such compassion and such empathy to one and use such stigmatizing language for the other? I just really encourage you, these subtle changes in the language that we use, using language like they are a person living with, they are a person managing their, whatever it is that they're managing, using respectful language like that. It is not semantics. It does matter, and it absolutely makes a huge impact on a person who's living with mental health. So I really encourage you to be mindful of the language that we're using. If you are interested in getting more information regarding language that is appropriate using person first language, if you visit the Mental Health Commission of Canada website, they have a link to language that is appropriate and ways that we can reframe common language that we use. I really encourage you guys to take a look at that. They have some fantastic resources on there. I would encourage you to take a look at that. And really, if we're going to combat stigma, let's start with language.
Okay. Thanks, Janan. Great introduction. Any questions? Any questions? No? Okay. So I'm just going to move on. So let's get into, why this particular crowd has tuned in. People are not always eligible for PDD, which is persons with developmental disability. It's government programs and services. And even if they have received FSCD supports up until the age of 18. Now, the scenario is the individual is past 18 or, close to being 18. They have mental health concerns that are serious enough for them to seek supports. Okay. They're willing to seek supports. What is it like? So if there's a caregiver involved, or even if it's the individual that's interested, what should be the next steps that the caregiver takes?
Excellent. So I'm actually going to break this up into kind of a couple of things to keep in mind. I want to start off with what's the first kind of effect that we should do? What's the first steps that we need to take? And then I'm going to break it down into specific resources for youth as well as specific resources for adults. So before we dive into specific resources, what I would like to do is kind of speak to what you were saying, Sahana, about what is that next step. So we have a young person who has identified that they're struggling with their mental health and is open to having mental health supports. As a support worker, as a caregiver, as a mom, an auntie, a sister, whomever, whatever role or hat that you're wearing, the first thing that we need to do is we need to have an honest conversation with this person, right? We need to have a conversation and we need to speak to what you see. We need to ask questions that welcome the person to talk about some of their experiences. And let me tell you why that this is so important. It's important because we can't leave any room for assumptions, and we can't assume that we know what the person looks like. I cannot stress this enough. Mental health looks different for different people. What depression looks like in me or what anxiety looks like in me may look very different for you. It's different for different people. So we can't just assume that if Johnny is talking about, feeling hopeless and helpless and this and that and the other, that we know exactly what they're going through, right? Or we just assume that that's depression, right? We want to ask those probing questions to really get, I always say, pieces of the puzzle to create a big picture of what's happening for this person. And we need to hear it from them. This will allow us the proper stepping stones to really lead us to that path to wellness. So that's the first thing. The second thing to keep in mind and to always factor in as a support worker is that we need to have realistic expectations of what this process is going to look like. Okay. Again, there is no cookie cutter or carbon copy experience or process when it comes to mental health. There's many, many different avenues. I was telling Sahana before we started, we could have a 3-day session on resources and process. Like, it is so, um, eh, it's so invasive. There's so many ways that we can do it. There are some people who thrive in group settings, that counseling, that one-on-one support. And then there are people who wouldn't touch it with a 10-foot pole. They need residential, structured, somebody telling them when to get up, somebody to tell them when to eat, somebody to tell them when to go to bed. So it's different things for different people. And we need to have realistic expectations of what this process is going to look like. We can't just assume if they go to counseling, they're going to get fixed. Or if they take medication, that they're going to get fixed. And in that spirit, it's important to always remember that recovery looks different for different people. Recovery does not mean the absence of an illness. That is one of the biggest misconceptions. Recovery does not mean the absence of an illness. What recovery does mean is different for different people. Recovery entails gaining a sense of hope, understanding one's not only disabilities, but their abilities. It talks about engaging in an active lifestyle, having a sense of purpose in your life, and a positive sense of self. That's what recovery means. So if I am struggling with, let's say I'm a chronic smoker, I go from smoking 5 packs of cigarettes a day to 3 packs or 2 packs of cigarettes a day. And in that 2 packs, I found a sense of purpose. I'm more active. My life is more fulfilling. That for me may be recovery. So it doesn't necessarily mean the absence of the illness. We need to have very clear, realistic expectations. And third, really important to keep in mind before we tap into resources, we need to understand that we have to get them connected. This is our primary objective. And people will not initiate that conversation, won't be that mental health ally. Why? Because there's this fear of, oh, what if I can't fix it? Or I don't know what to do. And what if I make it worse? And this and that. And I want to tell you right out of the gate, your job isn't to fix the problem. That's not your job. That's why we have psychologists, psychiatrists, doctors, social work. That's why we have those appropriate professional supports. Your primary objective is to get them connected. One of the things that I know for sure to be true is that mental illness thrives in isolation. Mental wellness thrives in connectivity. We got to get them connected. And we're going to talk a lot about how do we connect people to those appropriate professional supports, as well natural supports, your parents, your family, your loved ones. If you're connected to a faith group, right? Getting connected to that. If you're connected to a sports group, get them connected to that. A book club. Community, and connectivity is so important whenever we're talking about that road to wellness for mental health. Does that make sense? Does anybody have any questions? Excellent.
Awesome. Thanks, Janan. I turned off my video because my internet connection can be slow and I didn't want it to interrupt our conversation. My question for you, now that you've kind of gone over the next steps in the process, is maybe speak to the resources. And again, keeping in mind that it could be for a youth or an adult, but I'll let you figure out how you want to lay that out.
Okay, so I want to lay it out in 3 different avenues. I'm going to start off by giving you 3 universal resources that can be used for youth or adults, and then I'm going to specifically talk about youth resources, and then I'm going to specifically talk about adult resources particular to mental health. Okay, so first, universal resource. This is your first pass go. Your first point of reference should always be, drum roll please, your family doctor. That should always be your first point of reference. Why is your family doctor so important that they're the first point of reference? Let me explain. For starters, it's important that you have a trusted family doctor who knows your history, right? If we are talking about certain mental health disorders or certain mental health problems, it's important that we have a doctor or we have it documented somewhere of your history with this, okay? So if you're struggling with depression, for example, it is very valuable information to know that not only were you struggling with depression at, say, 35, but you also struggled with it at 17, right? And so always starting with your family doctor is important. They can also rule out any other ailments. So let's say I'm constantly tired, I'm constantly fatigued, I have brain fog, and I'm convinced that it's depression. I go to a doctor, the doctor's going to take blood work. It could very well be that I'm iron deficient. Symptoms of iron deficiency very much mimic depression, right? And so it's important to rule out any physical ailments. And finally, the benefits of having a family doctor, if we require certain specialized services, some of them require a referral from a family doctor. So when we look at things like a psychiatrist, for example, you can't just look it up online. That needs to be referred by your family doctor. So the sooner we have a family doctor in place, the sooner we can access those supports and get our mental health on track. Okay, so that's the first resource I'd like to give you. The second resource that I'd like to give you, and it never ceases to amaze me how people seem to forget about this, look into what your benefits cover. I can't tell you how many times I'm in a training and I ask people, give me a show of hands, how many of you know precisely what your benefits cover? And not one hand goes up. We have, for some, amazing access to resources, supports, chiropractic, counseling services through our work benefits, but we can't access what we don't know. You pay into these, so access those resources, access those supports, tap into those, see what they offer, see if they're applicable for your dependents, see if they're applicable to your children, and let's try to get some supports through that avenue. And finally, the last universal support I'd like to present to you is the 211 resource list. I'm not sure if you guys are familiar with this. I swear by this, and it has bailed me out more times than I can count. So if you go online and punch in 211 resource list, a page is going to come up for you that is done in partnership with the City of Edmonton as well as the Canadian Mental Health Association. And what it does is it breaks down all the human services supports that you can possibly imagine. Things like supports for seniors, supports for veterans, supports for pregnant moms, supports for immigrant families, supports for women, supports for men, supports for addiction, supports for mental health. And you just click what it is that you're looking for, and it will give you an entire page full of resources in your community. And it ranges across the province. You can just pick what area you're in and it'll tell you what resources are available to you. It's a fantastic resource. Sahana will put it in the chat for you so that you guys can take a look at that. I really, really encourage you to look at that. They have fantastic resources on there. So now let's dive into what are some resources for mental health, in particular for youth. Okay, now youth is a different age bracket depending on the agency. That doesn't necessarily mean under 18, and I'm going to clarify for each one. So the first resource I'd like to share with you is Access Open Minds. This is a initiative and a program that is run throughout the country. The resource that I'm referencing today is based here out of Edmonton. There's two locations. There's one out of the U of A, which is particular to the students. So if you're a U of A student, you have access to that. The other one is located downtown at 10211 105 Street. This is a free service that services youth from the age of 11 to 25. That is their definition of youth. And what they do is one-stop shop for youth who are struggling with their mental health. They offer things like therapeutic programming, meeting regularly to figure out and assess what's going on for an individual. They get them connected to supports that they need. They do evaluations and assessment, again, connecting them to appropriate care. They also do family work, right, where they support the families of the youth that are involved in their programs. And not only do they get them connected to the resources and the supports that they need, but they also do follow-up even after they've aged out of their care. It's a community-based program. It is a wonderful, wonderful program. And it is, you can reach them online at www.accessopenminds.ca. And their phone number is 780-415-0048. Again, that's Access Open Minds, 780-415-0048. Okay, so that's my first youth one. I've accessed them many, many times. They're remarkable. They really are fantastic. The next resource I would like to share with you pertaining specifically to youth is CASA. Some of you might have heard of CASA. They've been around forever. They are amazing. Shauna Lee, I see you shaking your head. Excellent. CASA is amazing. Now, their age demographic is infancy to 18 years old, so they cap at 18, and they do remarkable, remarkable works. I could do a day presentation just on everything that they do. They have a multidisciplinary approach to supporting young people, and what I mean by multidisciplinary is they have various specialized support workers who come in, everything from psychologists to psychiatrists to doctors to nurses to speech pathologists to social workers, you name it. Whatever the youth needs, they're able to provide. And so by implementing a multidisciplinary approach to supporting young people, they look at things like day programming, inpatient programming, psychological assessments and testing, support groups, and looking at different programmings that cater specifically to youth. They also offer therapy and counseling via phone. Right now, in light of COVID, they are minimizing their face-to-face meetings. However, I spoke with one of the directors yesterday, and she was very clear in saying our intention is to do as many telephone and Zoom conferences as possible. However, if there is an opportunity to see somebody who is at risk, we will absolutely see them face-to-face. So they offer that service as well. Similarly to Access Open Minds, they too offer family support, right? Because again, wellness thrives in community, right? And that community absolutely includes the family. So they do a lot of work with them. Again, amazing. Their phone number, oh, sorry, I don't have their phone number, but I have their website. Their website is actually easier because their phone numbers, they have various sites across the city. So if you just go on their website, www.casaservices.org. If you jump on their website, navigate through their toolbar where their program lists are, and you will see there is a plethora of resources and different sites that they have, and you can call them and get more information about their intake process, what that looks like. Their intake processes for different programs is different, but start off, check out their website. They are remarkable. The last resource that I would like to give that I think is probably the most versatile, the most amazing, I cannot praise them enough. I should be paid for the promotion I do for these guys. I love them. The Kids Help Phone. I don't know if you guys have ever heard of them. If not, I'm honored to introduce you to them. The Kids Help Phone is a remarkable nationwide initiative. So this is across Canada, and it is an organization that is geared towards supporting youth. Now, they support youth through a variety of different ways, but primarily it is a hotline that youth can call 365 days a year, 7 days a week, 24 hours a day, no matter what time, day or night. If you're struggling, you need help, and you're a young person, you just call and guaranteed somebody will pick up the phone. Now, they have a variety of different ways that they can help. They can help you via chatting. Now, in light of COVID, the chatting option has been temporarily paused. But in addition to that, they offer texting. So you can text 686868 and you'll get a support worker who will pick up the phone. These are trained counselors who will pick up the phone and walk you through whatever issue they're having. And it could be anything from, I had a fight with my mom and dad, to I'm thinking of taking my life, and everything in between. They are trained professional. They are highly, highly trained. This is their area of expertise. They do phenomenal work. So you can text them, or you can pick up the phone and call them at 1-800-668-6868. Again, that's 1-800-668-6868. Now, in addition to that, if you hop on their website as a young person or as an adult who's like a support worker, they have a ton of resources for how do you address bullying? How do you address depression? How do you have a conversation about anxiety? They have phenomenal work groups, videos, a ton of resources. So even though they're a fantastic resource for youth, they're also a fantastic resource for those who are not youth. Those are my top 3 go-to amazing youth resources. Now, again, we could sit here all day and talk about resources, but I was intentional in getting you guys connected to resources that can take specifically your situation and direct you to the supports that you need. And these, I think, will be very, very good for you.
Awesome.
Yeah.
And quick question before you move on. Kids Help Phone Helpline. Can you tell us the age group that it's relevant to?
Okay, so they say up to 18. However, they will not turn anybody away. I have actually tested this theory. I am 41. I have called and they have helped me through it. So I just also want to let you know, I have not given you guys any resources that I myself have not tried, tested, and know to be true. So they say 18, but they will not turn anybody away. They're a fantastic resource.
Awesome. Thank you.
All right, so now let's dive into some adult resources. But before I do, is there any questions about the youth resources or the universal resources we talked about so far? Clear as mud? Excellent. Okay, so now let's dive into adult resources. First things first, and again, I really want to praise a lot of the work that's being done here. This is a relatively new program. It is the first of its kind in Canada, and Edmonton was very fortunate to have it. I want to introduce you to Access 24/7. Now, some of you may be familiar with Access 24/7. Shauna Lee, your nonverbal is on point. I love it. Access 24/7 is, first off, it's located in Anderson Hall. And for those of you who are not familiar with Anderson Hall, it's close to the Royal Alec. The exact address, Sahana, is 10959 102 Street. So kitty corner to the Royal Alec. Their phone number, 780-424-2424. Again, 780-424-2424. Let me tell you why Access 24/7 is so awesome. First off, they are one-stop shop for mental health supports and resources. And it's mental health and addiction, okay? And why is that so important? If you've ever tried to navigate the mental health care system, what you'll note right out of the gate is you have to go to this person and tell them your whole life story. And they say, thank you very much. But actually you need to talk to this person. And then you go to this person and then you tell them their whole life story and they say, thank you. But you actually need to go talk to this person too. And so it becomes this ring around the rosy of having to tell your story 800 times. That is a huge barrier for somebody who's struggling with their mental health. And these guys clued into it. So they are under the umbrella of Alberta Health Services, and their intention is to be a single point of access for those who are struggling with their mental health. So you go in, you meet with a support worker, you talk about what your experience is, and they're open 24 hours. And in light of COVID, their practice has not changed. So once you go in, they ask you some safety questions, they make sure you wear gloves and masks and all that, but they still will see you in person. And so after you speak to a support worker, it's their role to then get you connected to the services that you need. Do you need a psychologist? We have one on staff. Let's get you connected. Do you need help with housing? Let's get you connected. Do you need help with addiction? Let's get you connected. And this support worker stays with you through the process to make sure that your needs are being met. They provide that buffer support. And I have to tell you, it's been, the feedback with Access 24/7 has been remarkable. So again, they support you with navigating through the mental health care system. They do screenings, assessments, referrals, consultation, crisis intervention. So again, similarly to the Kids Help Phone, if you are struggling with bouts of depression, or all the way to if you're having a full-on manic episode, or having thoughts of suicide, they are there to help and support you. And they offer outreach and short-term stabilization as well. So again, a bunch of amazing resources. I really encourage you, check out Access 24/7. They're remarkable. Just even if you're in the neighborhood, just walk in and you'll see for yourself the homey, welcoming nature of their organization. They really are remarkable. So that's the first adult resource for mental health I'd like to give you. The second one I'd like to give you is the Primary Care Network. Now, I'm sure some of you are familiar with it. Primary Care Network is available across the province. So depending, regardless of what region you are in, you could be in Medicine Hat all the way to Drumheller, Lethbridge, you have access to the Primary Care Network. So the Primary Care Network is online. You can check it out online, and they offer a plethora of resources, from counseling to getting a family doctor, to counseling services, referrals for specific workshops. They do a plethora of things. If you're looking to get intermediate counseling, and what I mean by that is, like, let's say you just need short-term counseling, you are able to get free counseling from there for free. You just require a doctor's referral. That's all that you need. Now, if you are, I just want to pause here for a minute and talk and go back to the doctor component, because there's one thing that I forgot to mention. So when we talk about Primary Care Network, if you jump on their website, you can find on there ways to find a family doctor. Let's say you don't have a family doctor, you can get on there and there is a link that says Find a Doctor. You can access Find a Doctor through that link. And what's so great about that link, and we talked about this in the morning session, is that if you access that page on their site, you can refine it to exactly what it is that you're looking for. So let's say that I only feel comfortable seeing a female doctor, right? I can hit female. Let's say I work 9 to 5 and I need a doctor that's available only in the evenings and weekends. You can put after hours. Let's say English isn't my first language. I would like somebody who speaks Spanish, for example. You can hit Spanish, and it'll give you a list of all of the doctors that are specific to your needs within your area. So important, so important. So all of this is available on this website. They're a fantastic resource. And again, it is multidisciplinary. So they have access to psychologists, psychiatrists, nurses, mental health care professionals, social workers. They really do run the gambit. They really are fantastic. So I strongly suggest that you take a look at that. And again, they are free. So that's really important to keep in mind. As well, Access 24/7 is free. Another free resource that I would like to give you is the distress line. Now, this is very, very, very important, and I feel like everybody should have this number in their phone, have access to this number, because this is very important. Now, the distress line exists across Canada, but depending on your region, the number differs. So in Edmonton, the number for the distress line is 780-482-HELP. So that's 782-4357. And what the distress line is very similar to the Kids Help Phone, but it's the adult version. Okay, so they are 24 hours a day, 365 days a year, 24 hours a day. If you are in distress, call this number. Night or day does not matter, and a counselor will be on the other end of that call to help support, guide you, get you connected to resources within your community, right? You don't have to suffer in silence. There are people who are available to you, and again, this resource is free. You don't pay a cent for it, okay? And the final resource that I would like to give you, now this is not free, but there's a reason that I'm giving you this, and you'll see in just a minute, is psychologytoday.com. I don't know if any of you guys have ever heard of this. Some of you might know the name from the magazine, but they also have an amazing website, and their website highlights all the certified psychologists available within your region. Okay, now I just want to highlight what the difference between a psychologist and a psychiatrist is. A psychiatrist is a medical doctor who can diagnose mental health disorders. They can also prescribe medication, okay? A psychiatrist needs to be referred through your family doctor, okay? A psychologist, which is what I'm talking about through Psychology Today, is in essence a counselor. They can help guide you, consult with you. They are a therapist that helps you navigate your emotions, what's going on for you. They can provide you a plethora of supports with various issues. If you're, relationship issues, if you're going through a divorce, if you are having issues with your child, whatever the issue is, they are able to support you. And what's so great about Psychology Today, and I get really excited every time I utilize them, if you go on their website, you can specify exactly what you're looking for. So you go into psychologytoday.com and it'll give you a list of all of the psychologists, right? You punch in your postal code or you put in Edmonton, wherever you're from, and then you can further refine it. So let's say I feel comfortable only talking to a male. So you can hit male. Let's say that I need somebody who speaks a different language. You can hit that. Let's say I live in a remote area or I have limited mobility and I'm not able to actually get out to my meetings. I need somebody that I can see through Zoom or through Skype. You can put online counseling, right? And so you can further condense it to exactly what it is you need. And they'll give you a list of certified, really talented, qualified therapists at your disposal. Now, again, this is not a free service, and therapists typically, especially in Alberta, will charge anywhere from, it can range anywhere from $100 to $200 an hour. But I don't want that to discourage you, because one of the great things about this is two things. Number one, this is why I said look into your benefits, because some benefits cover some portions of counseling. So let's say you have $500 that you can put towards counseling. Please don't make me do math. Social workers were not good at math, but let's say you're doing it at $100 an hour. That's 5 sessions that you can cover, right? The other thing that's really good is you can look for counselors that offer subsidies. These will be identified in their description as a sliding scale. Right in their description, it'll say sliding scale, and right next to it, it'll say yes or no. And what that means is if they do offer a sliding scale and you can't afford $100, you'll have a conversation with your counselor and they'll ask you, what can you afford? And if you can only afford $20 an hour, then that's something that they'll work with you on. It's a fantastic opportunity, and you'd be surprised, a lot of therapists under Psychology Today will honor sliding scales. So it's a great resource. I'm a huge advocate for counseling. So if a person is struggling, I really encourage you to get connected. And those, my friends, are resources for mental health, universal, youth, and adults.
Awesome. Thank you so much, Janan. That's a really good cover of everything that people are looking for. And what I really liked about the reasons you shared are that whether somebody's eligible for PDD or not, these are some options.
Yeah, yeah.
So that's great.
Hmm.
I will now move on to my next question. And in this one, I want to talk a little bit about addiction. So if, maybe another opening for addiction, what do you think about the barriers, the stresses, and what does stigma look like in addiction
Oh.
to mental health?
Barriers, stressors, stigma, these are all part and parcel, especially when we talk about addiction. One of the biggest barriers for addiction can be the stigma within dealing with addiction, right? So having to face that, coming to terms with I need help, right? Because that in and of itself can be perceived as a weakness for some, again, part of stigma. And the other barrier too is not only obtaining, but maintaining supports, right? Relapse is very common when we talk about support for addiction, right? And that's why earlier when I talked about recovery looks different for different people. And maintaining realistic expectations for starters is going to be very important. And the other thing too is finding those appropriate supports. Some people absolutely thrive in meetings, right? They love going to their NA meetings. They love going to their AA meetings. And on the flip of that, there are others who are like, you could not pay me enough to sit in those meetings and listen to everybody else's heartbreak. I can't do it. I need one-on-one supports. And that is really important to recognize with people. And that can be trial and error, right? One of the things I always say as a counselor, when we talk about medication and doctors, and under the umbrella of doctors, I mean actual doctors, psychologists, psychiatrists, any of those professional supports, they're like a good pair of jeans. Not every pair you try on is going to fit you perfect, right? You got to try on a few to get the right fit. And it's the exact same thing with medication. You got to try a few to get the right fit that works for you. You may have to try different dosages to get the right fit for you. And it's the same thing with appropriate professional supports. You might have to try a few to find out what works for you. When we talk about stigma with addiction, so much. And there's so many ways that I could take it. There's such stigmatizing language. I was recently in San Francisco, and it was really jarring to see the level of homelessness and mental health that is there. For any of you who have ever been to San Francisco, I think you know what I'm talking about. I was in the downtown area, and I remember taking a taxi, and I was having a conversation with the taxi driver, and I was telling him, the mental health here is very blatant. Like, you can really see it. And he says to me, "Oh, that's not mental health, that's addiction." And one of the things, and this too speaks to stigma, addiction is mental health. It absolutely is mental health. And that's why when we look at treatment for mental health, in particular addiction, we look at those concurrent disorders. We look at, what does trauma look like in your addiction? What does mental health look like in your addiction? Because addiction, very rarely, in my 20 years of specializing in addiction, I have never seen addiction in isolation, like the only issue be addiction. Addiction is multi-layered. There's a lot of shame and trauma and guilt and all of that that plays into it. So we have to address it all. Language plays a huge role in that. One of my absolute pet peeves, and I'm gonna get on my soapbox here for a minute. I'm just mindful of the time, but it makes my skin crawl whenever we ask somebody, "Are you clean?" Right? We ask this question, why? With the intention of what? understanding or assessing if they've been using substances, correct? But let's say that person has been using substances. What's the opposite of clean? It's dirty, right? And so that may not be our intention, but goes back to what I was saying earlier about always being mindful and intentional of the language that we use, right? Without even realizing that we've done that, you've now just labeled somebody as dirty. So one of the things, friends, I really, really encourage you is that if you were supporting somebody or a loved one through their addiction, never ask them if they're clean, right? We can ask them, have you been using? What have you been using? What does that look like for you? We can absolutely ask those questions. That's part of, assessing, getting pieces to those puzzles. But just be mindful and intentional and really ask yourself, what does it mean when I ask that question, right?
Awesome. Thanks, Jan. It's a very important distinction. Do you want a minute?
No, I'm good. Okay. I'm a chatty Kathy. I could talk for hours.
So with addictions, my question is a little more general. What can a caregiver do if they're supporting a young person with addictions?
Okay, so this ties really closely into resources. What can a caregiver do? Connectivity, connectivity, connectivity. So similarly to what we talked about with the mental health, how we need to speak to what we see, we need to have that conversation to figure out, number one, what is the stressor? What's going on? What does addiction look like for them? Because again, what it looks like for you may look very different than what it looks like for me. What is the impact that this is having on your ability to function? Is this a recreational thing, or are you not able to parent because you're hungover? Right? What is the impact on a person's ability to function? Because these are all going to be really important factors into what type of service that they're going to receive, right? And then again, recognizing and having realistic expectations. Recovery looks different for different people. So if you're, going in tights and cape with the expectation of, them not using that substance anymore, you may be disappointed, right? And so having those realistic expectations of what this process is going to look like is going to be really, really important. And then again, finding out what resources are available and getting them connected. It's all about relationships.
Awesome. So Janan, people often think that they exist in vacuum, that, if somebody has a disability, maybe they don't even consider that the person with the disability may have mental health issues. Mm-hmm. And so they focus on one or the other. Mm-hmm. Similarly with mental health and addictions, right? People feel that they somehow need to pick one over the other. Do we help them with their mental health? Do we help them with their addictions? So what would you say to people who are trying to figure out what needs to come first?
What I would say to you is that that's not our role. It's not our role to figure out what comes first. That's why professionals are there. Think of it when you go to the hospital for a broken leg, right? Do we worry about cleaning up the blood first or putting the bone together first, or do we stitch up first, right? There's a process that needs to occur, right? But I'm not a doctor. We need to leave that to the doctors. So in response to your question, all of it needs to be addressed. All of it. But the process in which that happens depends on so many different things. The severity of the impact of it, like what is taking precedence? Is it the addiction right now? Is it the physical health, or is it the mental health, right? What is taking the precedence? What is the root? And once we address the root, what does that look like for all the subsequent issues, right? So it really is different for different people. And this is where getting a good understanding of what that looks like for the individual is really important, because then as the support worker, we can take that information to the professionals and aid our loved one in expressing what's going on and helping them to get connected to the resources that they need. Does that answer your question?
Excellent answer. Yeah, I agree with you. I think we're used to addressing one thing at a time.
Yeah.
And human nature. And so this tends to be a question for folks.
And it can be very overwhelming, and it's important to realize what is our capacity and what needs to be left in the hands of professionals, right? Because that's where compassion fatigue comes into play, right? We got to be careful with that.
Yes, yes. Okay, so to delve a little deeper into addictions, walk us through resources for addictions that are in Edmonton and area,
Okay.
and how should one think about it?
Okay, so when we talk about addiction supports and resources in Alberta, in Edmonton, really, really the go-to is Alberta Health Services. Okay, and there are other resources that are privatized treatment centers, and absolutely those are absolutely a resource for you. But again, I think it's really important that if I'm in a position of giving you guys resources, I'm very particular about giving you resources that I have tried, tested, and I know are true. And what's so great about Alberta Health Services is some of you might remember Alberta Health Services back in the day where it was ADAC. Right? Do you guys, some of you might remember ADAC, where they solely focused on addiction, right? And this kind of talks about some of the questions that you guys had brought up about how, or Sahana, you had mentioned about the difference between mental health and addiction, right? When it merged into Alberta Health Services, they recognized that we can't treat one without the other, right? It's like putting a Band-Aid on a bullet hole, right? It doesn't work. We have to treat the multi-layers of it. So now whenever we look at addiction treatment, we look at not only the addiction, but we look at it as a whole issue, as a whole diverse issue. We look at addiction, we look at mental health, we look at what resources you have, what support systems you have, we look at previous historical trauma, we look at family dynamics. So all of that plays a role in it. Okay, so let's get started with youth. What does Alberta Health Services offer for youth? So in the capacity of youth, we're talking in this age from 11 to 18, okay? So Alberta Health Services is the youth addiction services. They are your go-to for mental health supports for youth. So again, youth addiction services. Their address, 12325 140th Street, 12325 140th Street. Their phone number, 422-7383. Now they're open Monday to Friday and do intake from 8:30 to 4:30. I recently had a conversation with some of their staff yesterday, pardon me. They informed me that aside from the school component that they offer, and I'm going to go into the programs that they offer in just a moment, but aside from the school component, all other services are business as usual. The school component has been shut down, obviously, because of COVID, but all other services are running as per normal. So some of the services that they offer is walk-in intakes. Again, that's from Monday to Friday from 8:30 till 4:30. You could just walk right in, you and your young person, and say, listen, I need some help. They will connect you to a counselor. That counselor will do a screening, will do a questionnaire, assess what's going on, and get you connected to appropriate services. Those services can look like detox. They can look like outpatient counseling if it's not severe enough to warrant, say, residential treatment, right? They may just need a counselor to talk to at a local Tim Hortons, so they can set that up. Family counseling they offer as well too. This is Alberta Health Services is really really thrives on inclusive treatment, including the families, right? And so family counseling is part of it. Day program, as I mentioned earlier, that's the schooling part of it. That has been shut down in lieu of COVID. And they offer residential treatment for up to 8 youth. They can house up to 8 youth for a period of up to 3 months. So this is where youth live on site, and they have a routine, a structure, and it's geared towards residential treatment for addiction. They also offer voluntary stabilization, so a 10-day detox program that is a voluntary program. They also offer involuntary detox through their PCHAD. You need a court order to access that. But if you go on Alberta Health Services website under youth, mental health and addiction, it will give you a list of all of the fun services they offer, and they will go into in-depth detail about the services that I just presented to you. And so I would really encourage you to take a look at what some of those youth resources are. They really are the one-stop shop when it comes to youth and addiction. Now, any questions about that before we proceed? No? Sahana, anybody with their hand up on your end? No? All right, let's move on to addiction for adults. What does that look like? So again, there's many private organizations that offer treatments throughout the province, and you're welcome to just look up Treatment Facilities Alberta, and you'll get a list of privatized treatment facilities. But the ones that I would like to speak to today are ones that I know to be really, really great. And those are the ones that are offered through Alberta Health Services. Now, Alberta Health Services, their adult service program is located at 10010 102A Avenue. So again, that's 10010 102A Avenue. That is their adult services office. Their phone number, 780-427-2736. Again, 780-427-2736. Now, let me give you a quick snapshot of some of the resources that the adult Alberta Health Services Addictions Program offers. So they offer individualized or group setting type therapy courses and workshops. So you can have one-on-one where you meet in the community, or they have group meetings where you can talk talk in a group setting, like a support group. They have medication management. So if you are taking any form of medication to help you detox off your medication, so anything like that, the Methadone programs, they offer you support through that. They offer psychiatric consultation, case management, crisis stabilization, and referral to support services. They offer detox. Their ARC program downtown offers, I believe it's up to 10 beds. Don't quote me on how many beds. I believe it's 10. But this is medically monitored detox, where there are nurses there who will support individuals from a medical standpoint to detox. They offer support to access residential treatment. So in order to access residential treatment, so things like Aventa, which is residential treatment for women, they're located in Calgary. Phenomenal. I've had such tremendous success with them. They're based out in Calgary. Pound Makers here in Edmonton or Henwood. Henwood is a treatment facility here that takes in residents who are interested in seeking addiction support. Pound Makers here offers the same thing. They offer Indigenous trainings and teachings as part of their model. To access any treatment services, it needs to go through Alberta Health Services. So you need a case manager in order to help facilitate that. And it's easy peasy. You just call the number that I gave on the screen, that 427-2736. You let them know that you're interested in some addiction support. They will get you connected, and that support worker that they connect you to will help facilitate the transition into those treatment facilities. Now, there is a cost to the treatment facilities. However, it's a per day per diem. However, if you are of Indigenous status, if you have any involvement with the justice system, if you are low income, or if you have any access to government services, so whether it be through AISH or Alberta Works or what have you, it is covered for you, okay? The support workers through Alberta Health Services, they really are the masters in obtaining and securing funding for these treatments. They really are low cost. So if there is a way to get it subsidized, they'll find it for you. So very rarely in my experience have people had to pay for it, because there's usually an avenue in which that can be covered. However, in saying that, if you are in a position to pay for your treatment and pay for that daily per diem, it eases off payments for other people, right? Because there's only so much for that pool of money to access. So again, those are residential treatments. They also offer community-based supports. So again, that one-on-one support where they'll meet you in the community, talk about what's going on for you, give you some great resources and tools in your tool belt to help you navigate whatever it is that you're going through. They can help get you connected to NA support groups, AA support groups, CA support groups. So NA, for those of you who are not familiar, are Narcotics Anonymous. AA is Alcoholics Anonymous, and CA is Cocaine's Anonymous. Okay, they run a plethora of support groups throughout the city. Now, in light of COVID, they have put those meetings on hold. However, they still offer them via Zoom. So it'll be interesting in the next couple of weeks here when the city opens up to see what that relaunch is going to look like for resources such as this. But again, the community support, the residential treatments, the detox centers, they are all running as per normal. They have put safety measures in place to ensure the safety of people. They've limited how much family can come in and all of that. But as a patient, it's business as usual.
Mm-hmm. Mm-hmm.
Any questions about those two resources? Again, if you go online and go to Alberta Health Services Adult Mental Health and Addiction, you'll get a list of all of the resources in greater detail, as well as who to specifically connect to, and it's really great. One of the things too that I really want to stress to you guys is there is an addiction hotline that is offered through Alberta Health Services. So if you have any questions about addiction, you're seeing something in your young one or your partner or your spouse that is giving you cause for concern, you're feeling helpless, you need additional resources, you need support, you can contact the addictions hotline through Alberta Health Services. They are, again, 24 hours a day, 7 days a week, 365 days. Call at night or day, somebody will answer. Their phone number, 1-866-332-2322. They will offer telephone advice, service referral, and this is for youth and adults. So it's not just for adults, it's youth and adults. And it could be any type of addiction, from alcohol, tobacco, drugs, gambling, sex addiction, any kind of information, any kind of addiction they will help you with. And that is the resources I have for you.
Thank you. Sorry for cutting you off there. No, this is a great presentation. Thank you so much. I think a lot of people just expect us to have resources here at a webinar like this, but you're able to provide how to think about this, and I think that is usually missing. Mm-hmm. So thank you for that. For those of you who might be interested in getting a certificate in health first aid, whether it's for yourself, someone your loved one, your family, your friends, your community. Jinan she owns Catalyst Services, and you guys provide mental health first aid training.
Yes, so mental health. Yeah, so Mental Health First Aid is a 2-day course that is offered through the Mental Health Commission of Canada. I'm a contract trainer for them. We offer it in the youth as well as in the adult course. And what this course is it teaches you how to be a first responder. So similar to how physical first aid teaches you how to be a first responder for physical ailments, I teach you how to be a first responder for mental health ailments. So how do we have that conversation with somebody who's struggling? We look at various mental health disorders. We dissect them. I teach you what they look like, the signs and symptoms of what does anxiety look like, what does depression look like, what does addiction look like, what does psychosis look like. And And then I teach you the skills to support somebody who's experiencing that specific disorder. And I also throw a ton of resources at you. You think I gave you resources today? You should come to one of my trainings. We really build that tool belt. Now, this training in particular is a face-to-face training. So for now, the trainings have been on hold in light of COVID-19, but I believe in the next couple of weeks, we are opening them back up again. So if you are interested in taking a mental health first aid course, please visit my website. All the information about the courses are there. And if you have any further questions, just message me through there. I'm happy to answer any questions you have.
And it is www.ctservices.com, correct?
ctservice.com, .ca, sorry.
Wow, you think I know this by now. CT service, oh, I got it wrong. www.ctservice.ca.
You got it.
Janan, I put up your email address earlier, and I think those of you who may have some specific questions for Janan that you didn't want to ask today, that's okay. You can email Janan.
Yes, please do.
Viewers who may not be able to read the chat, your email address again is j@ctservice.ca.
No, my email address is j@catalysttrainingservices.ca.
Okay, so your website and your email are
They're different.
Okay, got it.
Thanks, GoDaddy. I had nothing to do with that. It is the bane of my existence. I wish I could change it, but I can't.
No, it's all good. So j@catalysttrainingservices, plural,
yes.
.ca.
Okay.
And the website is www.ctservice.ca.
You got it.
And you had so many resources today, and something that you and I have talked about is you could create a document of resources for us. People are more than welcome to reach out to Gateway for that document, and you can email info@gatewayassociation.ca if you want a list of those resources. But at the same time, Janan, I know you encourage people to go to 211 and check out the same resources. And so, and AHS website has got all the resources as well.
Yeah.
So not anything different.
Check out the 211 resources. I think you guys will be pleasantly surprised of the list of resources that are on there. It's just remarkable. We are very lucky to be living in Edmonton. We have some fantastic resources. I have the pleasure of training across the country, but seeing what we have here in comparison to what some other provinces have, we are light years ahead of most provinces in regards to resources.
That's very encouraging. Any questions for Janan? We have half an hour and we're going to be winding up in 30 minutes, if not sooner. Any questions? It could be, a generic question. It could be a very specific question. Just be mindful to not give details of the individual.
And if not, that's okay too.
Yeah.
Again, I want to stress, if you guys have a specific scenario that you guys want to talk about, perhaps you don't feel comfortable talking about it on this platform, I really, really encourage you. Please reach out to me. Send me an email. I am more than happy to consult with any of you, provide you some additional resources, and consult with you regarding what's going on. It is absolutely my pleasure. Just reach out, and I would love to help you any which way I can.
Awesome. Let's go over a couple of questions we heard during the afternoon session. I think one of them was, I think the individual from Drumheller. She was talking about how when they tried to access services for a client who had a dual diagnosis, they were told that there's no therapist or a counselor who can support with that. And Janan, your response to that was around the fact that services should be available to everybody. Dual diagnosis is quite common, even if it's FASD, it's quite common. So people should be able to access service.
Yeah. So this lady that had asked this question in particular was really struggling. She lived in Drumheller, and she was trying to provide services for a young man who had a plethora of diagnoses and struggles and barriers. And one of the struggles that she had was that she couldn't find anybody who had the qualifications to support this young man. There wasn't a lot of FASD supports in the area that she was living, and the supports that were there were basically saying, because it's a concurrent disorder, that we can't support with that. So for those of you who are not familiar with that term, concurrent disorders is where somebody has more than one disorder. So it could be they're struggling with addiction and anxiety related disorders, or they're struggling with addiction and depression or psychosis. So it's a multi-layered treatment that needs to occur at that point. And this young man exhibited that. Now, whenever we look at, and this goes back to what I was talking about with ADAC and Alberta Health Services, right? Pardon me. In that we cannot look at addiction in isolation. Addiction is connected to so many things: trauma, shame, mental health, stigma. It is connected to all of those. So if we just address the addiction, all of that other stuff is still live and in full effect, right? So we need to treat the big picture. Now, unfortunately, in her specific circumstance, because she comes from a small town, and this unfortunately is the reality in some places where the small towns may not have the support, the staff, or the expertise that, say, bigger cities would have, just due to demographic, right? And so to say that they're not able to support because of they don't have the ability because it's a concurrent disorder, in and of itself is a false statement. That's what they're trained to do. Accessibility is a whole different story. So it's just a matter of getting them connected to resources that are applicable to what this young man needs.
Mm-hmm. And I think there was another question around housing. So if it's an adult that is struggling with their mental health issues, what are some housing options for them if they can't live with their families, or if they don't have residential supports? I believe the conversation went into the lady who was here from Alberta Health Services.
Now, I can't speak too much to housing because that's not my area of expertise. She had some fantastic resources in regards to the Housing First project, and how one of the gentlemen had expressed that it was those that were in need first, who had extreme needs, that were kind of pushed to the top of the list, that it wasn't a first come first serve. It was more of a triage approach.
Yeah, it's supposed to.
And he had some concerns about that, and they don't turn away anybody, because we know that if we're looking at effective mental health supports, stabilization needs to be a factor in that equation. We can't support somebody effectively with their mental health if they don't know where they're going to sleep that night, right? And so that's why programs like Housing First are so important and so imperative in our communities, because they understand that, right?
Yes, and speaking of housing, just want to mention that one of the sessions that fall under not eligible for PDD Now What will have Emma Potter from CMHA. She works for 211, and she will be here to offer some resources and to talk generally about 211 and how that works and how is it more accessible. And
she's amazing. You guys will love her. Yeah.
Awesome. I'm guessing there are no more questions. So we are ready to sign off. Thank you, everybody, for tuning in tonight. I really appreciate it. And next week, we're going to be talking about banking, ID cards, status cards for folks who are age recipients and or maybe homeless. And there's a bank called Four Directions that's part of Boyle Street, and they will be coming in to talk about, what do you do if somebody keeps losing their IDs over and over again? They have come up with a strategy. How does banking work if someone maybe needs more assistance and accessibility accommodations to understand how banking works? So this bank specializes in that, and they will talk to us about it.
I've utilized them quite a bit when I was a youth counselor. They do great work. They really think outside the box. They understand harm reduction. They're great.
Exactly. And yeah, it's very exciting. Looking forward to that. So it's next Wednesday between 1 and 3 p.m. or 7 to 9 p.m. And I will see you all there.
Can I say one thing before we sign off?
Sure.
First off, I just want to thank you guys all for giving me this platform to chat with you. It has been a pleasure. One of the things I do want to stress before we leave in the spirit of being a caregiver, compassion fatigue is a real thing. And just like we care for others, we need to also be mindful of our own mental health and our own self-care, right? We are living right now in unprecedented times, and that brings about a lot of stress. Please, please, friends, please take care of yourself. Factor in your own mental health and make sure that you're implementing your own self-care. Make sense? All right.
Words have never been spoken.
Thank you so much. A pleasure chatting with all of you. Go enjoy the rest of your night.
Believe it or not, we have a question. Sorry. What are some group homes or assisted living places that are available for someone that has special needs, mental health, but does not qualify for PDD?
Adult or youth?
I would say since they're talking about not qualify for PDD, so it'd be an adult. Does AHS have housing and residential options?
Alberta Health Services, do they?
Yeah.
You know what? I do not know the answer to that question. So youth is my kind of area of expertise with that. I know that they offer, there's a plethora of group homes for youth. For adults, I know that there is availability. Are they specific through Alberta Health Services? I'm not sure. But I always say the best way to get answers is to ask questions. Contact Alberta Health Services, and they'll be able to answer any questions in reference to that.
Mm-hmm. And if you can't get a hold of them, call 211.
Yeah.
And some people have said that they've even texted 211, and they find text is faster.
Mm-hmm.
So
yeah. The best way to get answers is to ask questions.
Awesome. Okay. This time it's going to be a real goodbye.
All right.
Thank you so much.
Have a great night. Thank you.
Bye, everybody.
Have a great night.
Bye.
Bye.